Hi, this is Dave Shern, and I'm joining you with our video update to News from National for May. This is the second month in which we've done a video update, and the first month was well received, and so we're going to try to incorporate this as a regular feature. This month, what I thought we'd talk about was what's happening in Washington and really throughout the country in healthcare reform, and some of the things that we're working on with regard to that. I think, as you all know, there are many moving parts here that need our attention. The good news is that behavioral health care is more fundamentally included in pretty much all aspects of the healthcare reform effort. And that's a terrific change over what has traditionally been the case, where behavioral health was seen as a separate system. The area in which that's not the case, and in which we're moving in terms of our advocacy, is the Health Information Technology Bill, which at this point in time excludes mental health professionals other than psychiatrists, other than physicians, for being included. And we obviously cannot not be part of the healthcare reform information technology structure. And so we're working with members of Congress to get behavioral health professionals added to that. Another big concern of ours is Medicaid and the discussion about Medicaid block grants, the discussion about entitlements, because as you all know, for people with mental health and to a lesser degree substance use conditions, Medicaid is an extremely important resource. And so we're working both to try to make sure that we continue adequate funding of Medicaid in these very fiscally constrained times, but we're also working to try to assure that as Medicaid expansion occurs, that the essential benefit package, which is part of that, fully incorporates mental health and substance use, and is structured in a way such that people with more significant disability associated with illness will find the kinds of supports that they need to recover and be full members of their community. We continue to work with a large coalition of our colleagues on the implementation of parity, and we'll be discussing what's emerged with regard to parity and all of these other healthcare reform issues at our annual conference this year. We have a very exciting healthcare reform track that we've put together that'll start with a Healthcare Reform 101 provided by leaders from the Department of Health and Human Services, focusing then on mental health specific issues with John O'Brien. A really exciting session we're going to have on the exchanges and the expansion of Medicaid, featuring some local speakers from Washington and our own Phil Wysick from Connecticut talking about their experience with expansion. And then we'll talk about do's and don'ts in terms of managed care contracting with Donald Rohner from Colorado, and our President-elect Ann Boughton, who has worked in the insurance industry as well as in public mental health for many years. We'll end up with a little bit of a discussion about the importance of advocacy with Celinda Lake, who's going to talk with us about some of the recent polling that's going on so that we can craft our messages to be maximally effective. This is a really exciting time to be in our nation's capital. And I think it's an exciting time for anyone who's interested in and concerned about health care in America. So I urge you to stay tuned to our News from National broadcasts, and I hope to see you all in June in Washington when we talk a great deal more about all of these issues in healthcare reform. See you then.